Good morning and welcome. We resume our VTE awareness series today, and we'll be talking about the economy class syndrome. Can sitting too long kill you? Some time ago, there was a case of a 42-year-old man who suddenly collapsed on arrival from a long flight, a 9-hour flight. On arrival, he collapsed and died. Postmortem showed massive pulmonary embolism. So this is not rare. It is called economy class syndrome. So sitting too long on a plane, at work, and even on your couch can trigger deadly clots. Why is sitting too long dangerous? Your blood is designed to move. When you sit for long, more than 4 hours, without moving your legs, the blood slows down, and this increases the risk of clot formation. Your calf muscles normally act as a pump. They pump blood from the lower limbs up to the heart, but they only work when you move. So when you move, the muscle pump in the calf is not working. Prolonged sitting leads to pooling of blood in the legs, predisposing to clot formation in the legs, which we learned is called deep vein thrombosis. And when you start moving, the clot can break off, travel to the lungs, and cause pulmonary embolism, which can be fatal. So this economic class syndrome can happen anywhere. It is not just about flying. Where can we have this happening? Long flights, and when we mean long flights, it's any flight more than 4 hours. Road trips, if you're on a long trip using the train, the bus, more than 4 hours without taking breaks. It can also happen in office jobs where you sit for too long without breaks, no standing up. This can also happen among gamers, binge watchers, students. So anytime you are sitting for too long without moving, you predispose to clot formation in the legs. Your muscle pumps in the calf muscles are not working, and we have said they only work when you are moving. Economy class syndrome. So yes, sitting for too long is dangerous. Who is at higher risk? If you have had a recent surgery or hospitalization, you are at higher risk of getting a clot when you sit long. If you are pregnant or in the postpartum periods within 6 weeks of delivery, if you are overweight, if you are dehydrated during long flights or even long travel, people who smoke, people who are on hormonal therapy, hormone replacement therapy, if you have a family history of clots, if you have chronic illnesses like heart failure, cancer, chronic lung conditions, and also if you are wearing tight clothing. So remember, if you have those risks, that increase your risk of getting clots when you sit for too long. But remember, even if you are healthy, those risks can still occur suddenly. So what should we do to prevent ourselves from the economy class syndrome? So remember, if you are on a long journey, if you're on a long flight, if you're having long trips, if you do desk work which involves sitting a lot, please ensure after every 1 hour you stand up and walk. Stretch your legs, flex your legs when you are seated down. Do not cross your legs for long. Stay hydrated, continuous sipping and drinking of water. Avoid alcohol and caffeine. Alcohol and coffee cause dehydration, so avoid those, especially during long trips. Some people may require compression stockings to boost circulation. So please remember, if you need to take a long journey, we have said anything more than 4 hours, please talk to your doctor about preventive measures. So during long distances, plan a stop after every 1 or 2 hours, walk or stretch. In an office job, set a reminder to stand. Answer that phone call when standing. Flex and stretch your legs. If you are on a long trip, stand up and walk along the aisle. Stay hydrated. Avoid coffee. Avoid alcohol, which can cause dehydration. When seated, stretch your legs. And after a long travel, if you notice the danger signs of a DVT, please act fast. If after a long travel you feel heaviness of the legs, swelling of the legs, aching of the legs, warmth, tenderness, sudden shortness of breath, rush to hospital. We said the danger signs: any leg swelling, one leg swelling is DVT until proven otherwise. After a long journey, any discomfort in the leg should be taken seriously. After a long journey or sitting for too long, any breathlessness, chest discomfort should be taken seriously. So please, before the next trip, plan accordingly. Take frequent breaks, stretch, stay hydrated. Tomorrow we discuss about the danger signs and the warnings you should not ignore. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time. Economy class syndrome. Yes, sitting too long can be risky.